Hi there, my name is Hofferber. I'm an adaptive exercise specialist here at NeuAbility, and today I'm going to be talking about activity-based therapy versus physical therapy. While those in need from a wide different range of pain or injury occurs, a person might typically go and lean towards seeing a well-known physical therapist. But when dealing with neurological disorders or pathophysiology, ones may go a new therapy route called adaptive exercise, which is primarily known as activity-based therapy. And activity-based therapy mostly works best post-discharge from a center such as Craig Hospital, where you might do a lot of physical therapy. But what happens when you leave Craig? I'm going to use that as reference to physical therapy today. Where do you go after that? What do you do? How do you move your body when you might have had a spinal cord injury or a stroke or a traumatic brain injury? And so that's where we come into play. At NeuAbility Neuro Gym, we do adaptive exercise as activity-based therapy. And we do this to help increase a person's confidence in being able to perform independently by themselves. We help with strength, we help with mobility, and we give people a sense of community, a place where they can see others who have suffered an injury themselves and can feel a sense of community to help a person feel one's more purpose in their life. Adaptive exercise, known as activity-based therapy, can be a very confusing topic or concept for some who practically think that it's physical therapy. While they do have a lot of similarities, there are key differences and focuses that each of the two do serve. Physical therapy, on the other hand, aims more at prevention, treatment, and diagnosis of a movement and musculoskeletal injury towards a greater population. While they do work with spinal cord injuries, traumatic brain injuries, stroke, activity-based therapy is more towards those neurological disorders and conditions such as spinal cord injury and stroke. Activity-based therapy goes more towards rehabilitation physically, cognitively, and emotionally at improving quality of life through daily activities. Activity-based therapy's goal is to look at retraining the nervous system to recover a specific motor task. So, for example, someone who has suffered a C5 spinal cord injury going down from the waist down, we would look at putting on functional electrical stimulation to help contract the muscles to prime a movement pattern that they might not have that motor function available, so we can get them to contract the muscles themselves using that electrical stimulation to help improve their muscle mass, their bone mineral density, and we can just help with their overall strength, keeping that up for all purposes of their health. Adaptive exercise looks at using specific equipment such as a sit-to-stand machine, a glider, a standing frame, the functional electrical stimulation bikes that are used to help promote strength in the legs. We use a lot of things called active hands that allow us, the client, to hold on to bars or dumbbells. We also use a locomat, a locomotor, which helps with gait patterns with walking. We use a lot of harnesses to practice walking, and it's all aimed at improving that body to brain connection. It's helping retrain that body to brain so we can hopefully see progress and the individualized person's specific goal or task. The similarities that both physical therapy and adaptive exercise have is that they both serve the same goal of helping someone in need with preventing further injury, with relieving pain, restoring function, and improve activities of daily living. They both can contain specialized staff, such as adaptive exercise specialist myself, or physical therapist, or a occupational therapist as well. But they both use some of the latest equipment and technology in their sessions, while physical therapy does use more of like a traditional gym equipment. adaptive exercises use more specific equipment tailored to neurological conditions such as spinal cord injury, stroke, or traumatic brain injury.